Hello, I'm Dr. Frita. I'm so sorry we've had some technical difficulties for our YouTube Live, but we still have an excellent lunchtime live for you. I thank you for your patience. I'm here with my practice manager, Shador, and a very special guest as we talk about HIV and AIDS awareness today is the board-certified infectious disease specialist, Dr. Lopez, Dr. Alvaro Lopez, and he'll be here to answer the questions that you have had and any live questions you have on HIV and AIDS awareness. Remember, this is just informational. This discussion does not replace your consultation with your physician. Also, make sure that you click the link in the description. I have a freebie for you, 10 healthy habits for a better you and a better life. Next week's video will be on vaping. That will be our next YouTube Live. But let's just get into some of the questions you've asked about HIV. Now, HIV is affecting about 36.9 million people worldwide. And here in the United States, even though African Americans make up only 12% of the population, African Americans account for 44% of the new diagnoses of HIV. So today, for the rest of this lunchtime live, we'll touch on your questions, hopefully get into some prevention, and just make sure you ask any questions you have. So Ms. Shador, what's our first question?
First question comes from HNYS1. Can you get HIV from someone who is negative, gay, sex, or not?
It's actually a great question. Yes, it is technically possible. If the person that you have sex with or use needles from has been exposed to HIV, is in what's considered the window period before their test actually becomes positive, then they can be contagious and they can transmit the virus of HIV. That window period is a short period of time between the time that they themselves were exposed and the time that they test positive. So it's roughly, used to be 6 weeks, it is now less than 4 weeks. So it's up to about 2 weeks or so for most patients.
That's such a good question. So you can have a potential sexual partner, you get an HIV test, it's negative, the partner gets an HIV test, it's negative. But if you catch the person in the window period, they may actually be HIV positive, but the time enough has not passed for the test to be positive.
That's exactly right.
So someone can say, this is my real test, it's HIV negative. But if they're caught in that window period where the test hasn't revealed itself as positive yet, then you can get HIV for someone who technically has an HIV negative test. So it's important to just practice safe behaviors, safe sex, use condoms, don't share needles, don't share straws with cocaine paraphernalia, don't share any of it if you're engaging in it. That's a really good question. What's our next question?
From V1, is it possible to display symptoms such as the flu or fever within 3 to 4 days of exposure?
Not usual. Usually you won't know or you won't have any symptoms for a week or two before you actually, after you're actually exposed. And the vast majority of people that are exposed to HIV will not have any symptoms at all.
That is very scary. That is very scary. So you could be infected and have no symptoms whatsoever.
You will have no symptoms, will not know that you are positive.
And then even if you are positive, the symptoms are very similar to a cold. So
Correct.
You can have swollen glands, swollen lymph nodes, fever.
It can just be the flu, especially coming into flu season. You could be thinking that all you have is a long-lasting flu.
So there's no red flag for if you have HIV. You just have to be safe, keep seeing your physician, get tested. Good question.
All right, thank you. From San Miguel 1, if a person is HIV positive, can they have a child even though they are infected with the virus?
Good question.
Another very good question, and it's something that we deal with now fairly frequently. Yes, you can. If the person's HIV positive, let's start first with the males. A positive HIV positive male who is viral load undetectable, so they are on medication and they have a partner. We worry about their partner, the woman. So if the woman is HIV negative, as long as the woman remains HIV negative, that child will be HIV negative. So we care about the woman, that the mom of that child needs to stay HIV negative. For women that are HIV positive, provided that they are on medication, provided that their viral load is typically undetectable, they can have a completely negative child by a normal vaginal delivery.
So ladies who are HIV positive, as long as they have an undetectable viral load, so they're on treatment and they push the virus load down in their bodies, they can be pregnant and actually have a normal delivery with an HIV negative baby. The child does not necessarily have to have HIV.
Correct.
Okay. Okay. Now, when you talk to patients, what kind of medications do you tell these mothers to take? Or do you prefer that they're already on treatment before they even plan for the pregnancy?
Well, we know for a fact that the vast majority of women do not quite plan for pregnancy. So if you know you're HIV positive, be on medicine from the start. No reason to wait. If you find out during your pregnancy that you are HIV positive, most OB doctors will now test you for HIV the first visit. If you find out you're HIV positive during that first visit, we encourage you to be seen ASAP to get started on medication ASAP.
Okay. So but to answer the question, an HIV positive mother, if treated, can have a baby who does not have HIV.
Correct.
All right, thank you. We have a question from viewer Gerald.
Hi, Gerald. Thank you for being patient and for tuning in. Hi.
He asked, is it possible to contract HIV or AIDS through oral sex?
Yes, it is.
And there's a short answer, because that's a big myth. People think that they're not really having sex, they're just doing oral sex. But what kind of conditions would make you get it? I assume if you have a cut in your mouth and you're performing oral sex, just any kind of secretion contact.
If you come into contact with any blood, and again, depending on what form of oral sex we're talking about, then yes, there are potential. If you come into contact with blood or sexual secretions, yes, you can acquire HIV from oral sex.
So then, where ladies are involved, there are dental dams, there are flavored condoms, there are ways, but just that's a great myth to dispel today. You can get HIV from oral sex, so be safe in all forms of sex.
All right.
Thank you for asking that question.
Good question.
Yes.
Next question is from Robbie. Is there some reasons why a person becomes reactive during the screening, or is there any related virus affecting the result? And can you name some of the related viruses?
So that makes me wonder, are they asking, is there a false positive? Like, can you have a reactive HIV test even if something else is positive, like a false positive? You test reactive or you test positive, but you don't really have HIV. How do you see that?
With current tests, there are a different number of tests that are done. So the home tests are different, or the rapid tests are different than the blood tests that we can do in the doctor's office. The blood test that we do in the doctor's office is what's now called a 4th generation test. And we should not do any of the 1st, 2nd, or 3rd tests because those are more error prone. With a 4th generation test, if it will read reactive, and we should interpret reactive as the same as positive. With all other forms of tests, the ones you can buy at the pharmacy, all the tests that are done by rapid screenings, any of those tests that read reactive need to be confirmed. So there is a potential for a false positive test.
Okay. So there are lots of health fairs where you get the rapid HIV test, or they'll do swabs in the mouth.
Correct.
Okay, and then there's tests that you can buy from a pharmacy, take home, do your own HIV test.
Correct.
But what you're saying is, so these are screening tests.
They're very good tests, but
Okay.
they're not as good as the tests that you and I can order from our offices.
Okay, so even if you do a screening test that's positive, go to the physician's office where you'll get a better test, a 4th generation test. And if that test is positive,
Then that's a positive.
then you have HIV. It's a more specific, sensitive test.
Correct.
Okay,
Correct.
All right.
good question.
Hi, Sharada. Thanks for joining us today.
Hi, thank
I
you.
don't think I have a question, but welcome. Next question is from Sonia. Once a person transitions from HIV to AIDS, can you return back to HIV positive once you get your CD4 count up?
Ooh, that's a very good question. So from HIV to AIDS, well, let's talk about the definitions of being HIV positive versus the AIDS? What is the difference?
So for years now, we've considered AIDS when you have specific infections that occur or when you have some specific cancers that occur. We also, historically, the CDC, the Centers for Disease Control, who really make the definition that we follow, has considered a magic number of a CD4 count, and these are the cells that are your defense cells in your immune system that the HIV virus attacks. If your number falls below 200, even if you're perfectly healthy, we have considered that as being part of the definition of AIDS. So if you have an infection, you can have AIDS. If you have a bad number, you can have AIDS. If you have some forms of cancer, you can be labeled as AIDS. For practical purposes, I would like to emphasize that that's a label, and when people take medication, regardless of where they start from, we expect to see improvements, and we expect to see dramatic improvements in most cases. So then your numbers will increase. Again, from a definition standpoint, you'll still have AIDS. From a life standpoint, it really doesn't matter, and you can have quality and quantity of life when you are in care.
So for the HIV positive patients, I have patients in my practice who presented technically with AIDS. They had some of those infections like the yeast or in the esophagus, esophageal candidiasis, or they've had pneumonia, what used to be the PCP pneumonia, these AIDS-defining illnesses. They've had CD4 counts that were very, very low, much lower than 200. And I have more than one patient, they've gotten on treatment, and now their viral loads have been undetectable, and they have very high CD4 counts. So the answer to the question is, while technically they're labeled as still having AIDS, when they have that low HIV viral load or undetectable and a high CD4 count, then they can do well, have very nice lifespans, have nice quality of life, such as my patients are having.
Correct.
So technically the label of AIDS is there, but it doesn't matter for all practical purposes, because if you have a low viral load then and a high CD4 count, then you can still have a wonderful quality of life.
And I would not want anybody to get too hung up on the label.
Right.
No, it's more important where you are going and where you're going to be than where you start.
Yeah.
Okay, we're going to look forward at all times.
And I just want to emphasize, because it surprises me that in 2019 there are still some misconceptions. Some people still think that HIV or AIDS has a certain look, but there are so many people, you would have no idea, people I see in and out of my practice who have HIV, who have had technically the AIDS before, who are thriving, doctors, lawyers, politicians, moms, you would have no idea. So you can have a wonderful full life, but also remember that when you're engaging in high-risk behavior, there's no look to it. So you must practice safe behavior at all times. Any more questions, Ms. Shador?
I do have one other question from Peggy. This is my true case. I have almost all the symptoms: joint pains, muscle pains, swollen lymph nodes, hotness of palm and leg, hotness of stomach, night sweat, even hotness in my mouth and tongue. Yet I have tested in 2 different places within 3 months of suspected exposure, but they came back negative. Did I test too early? What else could be going wrong with me? What else can I do?
That's a good question. So hot mouth, lymph nodes, fever, all kinds of things, but even after 2 months, still negative. What are the chances of?
Most patients will become HIV positive within 6 weeks after being exposed.
Okay.
So again, with a 4th generation test, different from the home test, different from a screen test, with a 4th generation test, that will pick up HIV. So in this particular scenario, if they have had that test and they are negative, then you can be reasonably sure that they are negative, and then there's something else going on.
Okay. So it's going to be important to make sure 4th generation tests get to, and there are other things, lupus, autoimmune disease, non-specific things. So we're about to have to wrap up. So sorry we had the technical difficulty. PrEP is something I wanted to get into, and I do want to touch on that just so briefly. There is something, pre-exposure prophylaxis, that people who are HIV negative can take to prevent the HIV virus.
And that's worthy of an entire conversation, and I look forward to that conversation.
All right, we can have
Again,
another conversation.
we will have that conversation.
All
That's a most important subject.
The PrEP. Click the link in the description, and in order to talk to Dr. Lopez, make an appointment to see him, he is a board-certified infectious disease specialist. He's an HIV specialist. Click the link in the description, and you'll be able to contact Dr. Lopez. Thank you so much for coming.
Thank you.
Make sure you also remember to download that freebie, that free PDF, 10 Healthy Habits for a Better You and a Better Life. Join us for our next YouTube Live. We will be talking about the dangers of vaping, which you're seeing in the news right now. Thank you, Mr. Dorr. Thank you, Dr. Lopez, and especially thank you for your patience and for watching. Always continue to live your healthiest, happiest life. I'm Dr. Frita. We'll see you next time.